Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Then the next stones are silicate stones. These silicate stones are mainly associated with long-term use of antacids. These are associated with long-term use of antacids which contain silica. In them, silicate stones are seen. Then we have triamterene stones. Okay, the triamterene stones. What is triamterene? Triamterene is an antihypertensive medication. This triamterene results in the formation of radiolucent stones. Because radiolucent stones are formed, they are not visible on X-ray because they are radiolucent stones.
thank you and thank you for watching.